Hello, everybody. This is Empowering Democracy. I'm your host, Joe Firestone. I expect to be joined somewhere down the line by Dee Pierce, the host of Around the World with Dee and Friends. But she and Madeline Hoffman are continuing the very interesting discussion we were having about foreign policy. Which I had to leave to begin this stream. But anyway, what this stream is about, topic of this stream, is healthcare costs, fiscal sustainability, and dumping the corruption. Okay, and I'll begin this stream stream. Please hang on for a minute while I get into a better position to do this. I'll begin this stream with a piece, with a post from the Peter G. Peterson Foundation. I thought that post was kind of interesting from a number of points of view, but also very silly, as most posts of the Peterson Foundation are. Of course, the Peter G. Peterson Foundation is the foundation started by Peter G. Peterson back in 2000. I think its founding was in 2008, if I recall correctly. It was founded with close to $1 billion investment from Peter G. Peterson. Well, Peter G. Peterson is dead now, and his son is continuing running the foundation. His son's name is Michael Peterson, if I recall correctly. But anyway, they do their standard thing from time to time. Their standard thing is to talk about the fiscal sustainability problems that exist for the United States. They've never accepted the point of view that since the United States is a monetary sovereign that can create its own money, at will, and that doesn't have debts, in a foreign currency, that it cannot have any fiscal sustainability problems. But let's go to the Peterson article and look at its claims and their connection to healthcare costs, because the Foundation article is about the idea that healthcare costs are driving increasing fiscal unsustainability in the United States. This post was created on July 24th, 2023. You should be seeing it now. Yes, you are. It's one of these short things from the Peter G. Peterson Foundation. The headline says, healthcare costs are a major driver of the national debt. And here's the biggest reason why. As the recent long-term projections from the Congressional Budget Office show, the national debt is on an unsustainable path. Now, right there, I have to stop. The reason why I have to stop is because the CBO isn't able to accurately project out 6 months. its long-term projections aren't worth the paper that they are printed on. They are printed on paper because the PTG, or I'm sorry, CBO does issue paper reports as well uh, as reports, okay, in virtual format. So there are these paper reports, and their projections aren't worth the paper they're printed on. But according to these projections, the claim is that the national debt is on an unsustainable path. Now, when they say that, they always say that based on their projections about taxing and spending and borrowing. They never recognize that Article 1, Section 8 of the Constitution gives the federal government the authority to create an unlimited amount, okay, of money, the power to coin money, okay, is an unlimited power which the government has. Now, the government includes the Congress. So, of course, the Congress has to appropriate these unlimited funds. But provided only that the Congress wishes the federal government to avoid a default, there is nothing stopping the Congress from paying any national debt back as the debt falls due and with the interest that is owed on the national debt. The ability to do that is written into the Constitution. It only requires a Congress that is willing to avoid a default. So the debt is not on an unsustainable path. Or at least it could only be considered as unsustainable if you think at some point that the Congress is going to voluntarily default. When I tell you that a single platinum coin could be used to pay back all the debt, that is the truth. You could mint $100 trillion platinum coin, use it to pay off the current debt as it falls due, and create a situation where the federal government no longer had to issue any debt when it deficit spent. So there's no unsustainable path without making certain assumptions, which CBO is making, and which the PGPF, the Peter G. Peterson Foundation, also makes when it does these particular analysis. However, their assumptions in some cases are false. Like they say, under current law, the nation's debt trajectory will rise from nearly 100% of gross domestic product, GDP, in 2023 to 181% in 2053. So they say that. That's not true, because under current law, the United States can mint that coin and pay off the national debt, change the trajectory of the national debt. It doesn't even require congressional action. The president has the authority to do that. Joe Biden could mint the $100 trillion coin. So under current law, there is no necessary trajectory that is going to create uh, a debt to GDP ratio of 181% in 2053. But even if that were to occur, that debt to GDP ratio doesn't matter. It doesn't affect the fiscal sustainability of the United States, because the United States can go right on deficit spending, and it can issue further bonds. And if someday people don't want to buy those bonds, it then can issue platinum coins to cover its domestic spending. So the statement that under current law, the nation's debt trajectory will rise from nearly 100% of GDP to 181% in 2053 is a false statement. Under the current implicit assumptions the PGPF is making, that may result in a debt to GDP ratio of 181%. But I put to you, that's not the end of the world either. How do we know this? Because Japan has a debt to GDP ratio already today of something like 260%, and they are rollicking along perfectly happy with a debt to GDP ratio of that sort. And the PGPF knows it very well. They just don't want to talk about it. They just don't want to discuss it. They just don't want to examine their assumptions, lest people come to understand their assumptions are ridiculous and false. One of the largest drivers of that rising debt, they say, is federal spending on major healthcare programs, such as Medicare, and Medicaid. What? What? Why is Medicare, why are Medicare, and Medicaid drivers of the national debt? Last I looked, there were accounting records for Medicare, and Medicaid that showed that there was money left in their so-called trust funds, and whether or not they run out of money in those trust funds depends on money that Congress will or will not appropriate according to the choices of Congress. But of course, people are paying for the Medicare and Medicaid trust funds right now through FICA contributions. We all know that. Such spending is projected to rise by 78% over the next decade and will exceed all other categories of federal spending. Well, again, there's an assumption made there. And the assumption is that we're going to stick with our present healthcare system. But surely there's no intellectual honesty here. Because who wants to stick with our present healthcare system? More than 70% of the country wants to shift to a Medicare for all system. And they want to do it quickly. Of course, we know there's opposition in Congress to this. We'll get to that opposition later. And we'll get to its relationship to dump the corruption later. But the point is, these projections are not valid projections because the assumptions in back of them are terribly unrealistic. With 70% of the public, of the voting population, in favor of Medicare for all, sooner or later, Medicare for all is going to be passed. We may have to do some very, very good things to get it passed, and we'll discuss those later. But the basic point is that simply the adoption, okay, of Medicare for all can totally knock these projections into a cocked hat, the proverbial cocked hat. Okay, here are their projections. I've already stated why their projections are not important, so I don't even have to go over them. Oh, look, by the way, the net interest projection is worse than the projection of major costs for healthcare programs because that's on an even a more sharply rising trajectory, as you can see from the graphic. Also note Social Security is pretty flat. The assumption here is that discretionary spending is going to be pretty flat. Boy, that's wrong because that includes military spending. And we've just seen how military spending can, that's not going to happen. Uh, anyway, discretionary spending can certainly rise, but I think we have to start talking about. Oh, they talk about the fact broadly influenced by two factors. Their projection, the changing demographics of the population. As more people reach age 65, enrollment and therefore spending on federal programs such as Medicare rises. Okay. Additional cost growth, generally defined as the rate at which healthcare costs adjusting for demographic changes outpaces the growth rate, okay, of the economy. Cost growth, again, implies that we stick with the same system we have now. We're not going to have the same kind of cost growth if we have a Medicare for all system. Okay. So I don't think I have to go through any more of this, really. The arguments, okay, are not important when you understand. First point, that the United States is a monetary sovereign and can pay off whatever debt it incurs. So the level of the national debt, whether it be 35 trillion, 50 trillion, 75 trillion, has no effect on the ability of the federal government to keep on spending. Also, the level of the debt to GDP ratio, whether it's 100% or 30% or 180% or 300%, has no bearing on the fiscal sustainability of the United States because that sustainability is controlled by Article 1, Section 8 of the Constitution, and the willingness of the Congress to live up to its obligations and prevent a default on the United States debt. The 14th Amendment, Section 4, if I recall correctly, provides a mandate to Congress that it must repay the debts of the United States. Now, Congress, of course, may choose to disobey the Constitution. Congress may choose to take the United States into a default situation. But none of that is required by the Constitution. It would only be terribly bad behavior by the Congress that would cause that to happen. That behavior is a matter of political control. It's not a matter of making a passive sort of projection as to what must happen. None of what the PGPF talks about here, okay, is inevitable It's all under control of the political system. So let's move on. But first, let's talk about what was the PGPF trying to do here? What did it have in mind? It seemed to be interested in persuading people that we're spending too much on Medicare and Medicaid, and we have to cut our Medicare and Medicaid costs. We have to cut our healthcare costs. Well, there are many different ways to cut our healthcare costs. One of the ways to cut our healthcare costs, which, by the way, national health expenditures in was it 2023 or 2022? I forget. The latest figure from CMS that's out, though, uh, is a cost of $4.3 trillion on national health expenditures. So we've got to keep that figure in mind. It's now $4.3 trillion. That is the result of the healthcare system that we currently have here in the United States. The system of private insurance, the system of government programs in place right now, the various characteristics of the healthcare system, the fact that there are no controls on things like the prices of drugs, all that contributed to the $4.3 trillion worth of spending. There was a recent study done and published in the Milbank Quarterly. I'm going to bring the abstract of that study up, because the abstract tells us all we need to know. This is the Wiley Online Library, and it reports on original research called Century-Long Trends in the Financing and Ownership of American Healthcare. The authors were Adam Gaffney, Steffi Woolhandler, and yes, it is Steffi, it's not Stephanie, it's Steffi Woolhandler, and David U. Himmelstein. Himmelstein and Woolhandler are perennial writers on the costs of healthcare system here in the United States. They are founders of the Physicians for a National Health Program, the PNHP. They are prolific writers, and publishers. They've been doing research on century-long trends in the financing and ownership of American healthcare for a very long time. Adam Gaffney is a recent president of PNHP, and the three of them did this particular study. And here is what they found. They all are national authorities on healthcare. The abstract provides the policy points. I'm going to increase the size of the type here so you can see better. I think I am successfully sharing this. Let me double check. Yes, I am successfully sharing it. So I'll make the type even larger now. Okay. So here are the policy points from the abstract. Over the past century, the tax finance share of healthcare spending has risen from 9% in 1923 to 69% in 2020. A large part of this tax financing is now the subsidization of private health insurance. So let me give a few words about what this means. It means that the governments of the United States, both the federal and state governments, are covering right now 69% of national health care spending. We just learned that national health care spending I believe it was in 2022, the figure that I quoted, was $4.3 trillion. As of 2020, the proportion covered by the governments, federal and state, was 69%. If you multiply 4.3 trillion by 0.69, now this would be off a little bit since the trend is up. It's probably larger than 65% in 2022. But let's just take 69%. That would mean that our governments are already covering $3 trillion approximately of what we spend on health care. Of course, I won't talk about this being tax finance because it isn't really tax finance, at least the federal part of it is not, but I don't want to go off on that sidetrack right now. Okay, the point is that people, through their taxes, are producing enough money are having to pay $3 trillion. That doesn't count what they pay in copays, and deductibles, and what they pay to insurance companies, what they pay to the federal government to finance, to federal and state governments to finance healthcare spending is already at $3 trillion. So let's keep those two figures in mind. $4.3 trillion in spending, $3 trillion in government spending. In other words, of the $4.3 trillion, $3 trillion is already covered by the government. Of course, that is offset by taxes as well. Ultimately, of course, it's all coming out of private sector pockets, of course. But $3 trillion is already covered by government. Let's go on. For-profit ownership of healthcare facilities has also increased in recent decades and now predominates for many health sectors. A rising share of physicians are now employees. They're no longer on their own. They're no longer in private practice. U.S. healthcare is increasingly publicly financed, yet investor-owned, a trend that has been accompanied by rising medical costs and in recent years, stagnating or even worsening population health. A reconsideration of U.S. healthcare financing and ownership appears warranted. Of course, the Peter G. Peterson Foundation does no such reconsideration when it does its silly projections. Context: who pays for healthcare and who owns it? Determine what care is delivered, who receives it, and who profits from it. we examine trends in healthcare ownership and financing over a century. Methods. We use multiple historical and current data sources, including data from the American Medical Association, the American Hospital Association, government publications. That looks like it's D. Hello, D. Welcome to the stream.
Yes, thank you for having me.
Sure. Our topic tonight is healthcare costs, fiscal sustainability, and dumping the corruption. And the
Right.
first article we went over, and we didn't even go over all of it, just a couple of paragraphs, was from the Peter G. Peterson Foundation.
Well,
And that was a little statement of theirs saying that what we were doing in the United States was fiscally unsustainable, that our national debt was fiscally unsustainable, and if we don't change our ways, it would go up to 181% of GDP by 2053.
let's get to it.
So, okay, of course, I explain why our debt is not unsustainable because the United States is monetary sovereign and can always avoid any default on its debt just by creating the money it needs. I mentioned, of course, the $1 trillion coins in that respect. I didn't talk about overt congressional financing because I didn't want to go too far off track here. What I wanted to point out is that the unsustainability point, it was BS, but their article, the PGPF article, also focused on Medicare and Medicaid costs as driving the national debt.
Oh, for heaven's
So,
sakes.
of course, what I pointed out was that that wasn't driving the national debt because, first of all, okay, it's paid for by trust funds, okay, at least to some degree. And I also noted that the trust funds are accounting records. But I then also pointed out that any rise in healthcare costs is driven by the healthcare system we have now. I pointed out that with 70% of the voting population in favor, okay, of Medicare for all, at some point we have to get Medicare for all. And I pointed out that that was totally going to change the financial picture, totally reduce costs. And then I proceeded to the second article, which is being considered here. And that's where we are now. We are in the
Okay.
middle of that article. Uh-oh.
What's that?
I inadvertently got rid of that article, so I'm going to have to bring it back up, but that's not going to be a problem. Okay, there it is. I have to put it in the stream again. I got to present it and put it in the stream, but that's not going to be a problem. Okay, this piece is from the Milbank Quarterly, and we have been going over its text here. It's an article by Adam Gaffney, Steffi Woolhandler, and David U. Himmelstein called Century-Long Trends in the Financing and Ownership of American Healthcare. One of the key points I made in going through the article was that over the past century, the tax finance share of healthcare spending has risen from 9% in 1923 to 69% in 2020. I also pointed out that the CMS estimates of national healthcare spending, total national healthcare spending for, I believe it was 2022, had risen to $4.3 trillion. So while noticing that things were probably even more than the conclusion I'm going to come to, because since the trend in government coverage of healthcare spending is going up, okay, in each year, in 2022, the percentage was probably greater than 69%. But I took the 69% as a multiplier for the
Mm-hmm.
4.3 trillion to get to a figure of what, to an estimate of what federal and state governments were covering in healthcare in 2022. And by multiplying the 4.3 trillion by 0.69, the answer to that is roughly $3 trillion. It's a shade under $3 trillion. But certainly, if the figure were there for 2022, it would have been sufficiently over 69% to bring the figure to more than $3 trillion covered by the government. That was the central point I wanted to make. There were other policy points in the abstract of this article. This is just an abstract, okay, which we're going over. But
Mm-hmm.
that first point was really the key point that I wanted to bring out, that the governments, state and federal, are currently already covering $3 trillion worth of the $4.3 trillion in healthcare spending every year. Okay, so then I briefly talked about the context: who pays for healthcare, who owns it, will determine what care is delivered, who receives it, and who profits from it.
Mm-hmm.
And the authors say, we examine trends in the healthcare ownership and financing over a century. And I was going through the methods they used for it. We use multiple historical and current data sources, including data from the American Medical Association, the American Hospital Association, government publications and surveys, and analyses of Medicare provider of services files to classify healthcare provided ownership as public, private for profit, and private not for profit. We used U.S. Census data to classify physicians' employers as public, not for profit, or for profit entities, or self employed. We combined estimates from the official National Health Expenditures accounts with other data sources to determine the public versus private share of healthcare spending since 1923. We calculated a comprehensive public share metric that accounted for public subsidization of private health expenditures, mostly via the tax exemption for employer-sponsored insurance plans or government purchase of such plans for public employees.
Mm-hmm.
And we're now getting to the findings. For-profit ownership of most healthcare subsectors has risen in recent decades and now predominates in federal, including nursing facilities, ambulatory surgical facilities, dialysis facilities, hospices, and home health agencies. However, most community hospitals remain not for profit. Furthermore, over the past century, additionally, over the past century, a growing share of physicians identify as employees. They don't have their own businesses, they're not self employed. A growing share. Meanwhile, the comprehensive taxpayer finance share of healthcare spending has increased dramatically from the 9% in 1923 to 69% in 2020, as already mentioned, with taxpayer finance subsidies to private expenditures accounting for much of the recent growth. And the conclusions, a brief conclusion. Okay, specifically, American healthcare is increasingly publicly financed, yet investor owned, a trend accompanied by rising costs and recently worsening population health. A reassessment of the U.S. mode of healthcare financing and ownership appears warranted. So, those are the conclusions I want you to be aware of.
Read that conclusion again.
American healthcare is increasingly publicly financed, yet investor owned.
That's crazy.
That's crazy. We are financing it. Investors own it. Investors profit from it. But we are financing it. The public is financing it. It's financing it to the tune of, well, as I said, there's the 69% figure for 2020, but by 2022, that figure was surely over 70%. So 70% financed
Crazy.
by governments, the federal government and state governments. From the state governments, of course, it's financed by taxes. From the federal government, it's financed by government money creation, because that's what always happens, but that's accompanied or offset by taxes uh, at the federal level, okay, unless it's funded by deficit spending. But our healthcare programs are not funded by deficit spending. So, yet investor owned, a trend accompanied by rising costs and recently worsening population health.
Exactly. Because it's
So
for
we're
profit.
financing it, they're profiting from it, they're managing it, so we're getting rising costs and worsening population health.
Exactly, because they need a sick population to profit.
We need a reassessment of the U.S. mode of healthcare financing and a reassessment of the ownership appears to be warranted. Excuse me a second.
Okay.
So, let me get to the third article, then I'm going to get to the argument,
Uh,
which is a very, I think, very, very compelling argument. Uh, what did I do? Did I inadvertently? No, I did not inadvertently. So let me get to the third article here. That is not an article, actually. What it gives you is estimates. It's about health insurance resources and health spending based on OECD data, international comparative data. Okay. It shows health spending for various countries. For various countries. You'll notice the outlier here. That's the United States. That's the outlier. This was as of 2022. Government compulsory US dollars per capita. The estimated value was 10,644. I'm going to tell you right now, that estimate is wrong. As of now, we are looking at roughly $12,000. Last year, $12,000 per person, per capita. Okay. Last year, the spending was something like $11,300. And
hmm.
of course, it's gone up. Okay, so I'm estimating roughly $12,000 per capita. Okay. Our closest competitor was Switzerland, $8,049 per capita. Okay. Switzerland has a regulated but private health insurance industry. It's tightly regulated, but it is private. It does have some profit in it. And that's why it's close to ourselves in spending. Here's Norway, 2022, roughly $7,900 per person, okay, is what's estimated. Norway has a national health service. It's not private, okay. Here we have the Netherlands, $7,358. But what I want to do is get to nations that are culturally most like the United States. Okay, but notice you don't have to go too far down among these countries until you get to figures which are roughly one half of what we are spending. For example, the Belgium total in 2022 was $6,600, while it was something like $11,300 here in 2022. So here we go a little further. Here is Australia. Australia has a Medicare for All system like the one we've been contemplating. It spent in 2022 $6,596 per person. That was the estimated expenditures, getting near to 50% of what we spent in 2022. We were at 11,300, I believe, in that year. They were at $6,596. Here's France. They don't quite have a Medicare for All system, but it's very similar to one. They were at $6,517. Sweden has a national health service, $6,438. But when we're talking culturally similar countries, Australia, very culturally similar to the United States. The people have similar values to our own. So we're not talking countries of the European in culture. Canada, $6,319. You can be sure it did not increase by that much in 2023, by very much in 2023. They have rising costs, but they're not sharply rising. They're just about 50%, or were about 50% of where we are now. I'm not going to go through all of these. I wanted to hit New Zealand. Again, they have a Medicare for All system similar to the one that we're considering. They were at $6,061 per person in spending. We were in 2022 roughly at 11,300 per spending, and I don't really think that figure's correct. I think I'm underestimating it. I think my memory's a little faulty there. I would bet money that I'm underestimating what it cost. But I don't want to quickly try to find that out right now. So we're talking roughly 50%. When countries go to Medicare for All, and they are culturally similar to the United States, as evidenced by Canada, Australia, and also New Zealand, they spend about 50% per person compared to what we spend. There's one other thing I want to show you.
Okay.
If it shows up on here, if I can get to it. It may not show up on here because Taiwan is not considered, okay, a nation let me squint at this chart and see if they give Taiwan here. Okay, there are other very interesting cases here, but I'm just trying to get to Taiwan is not, of course, culturally similar to the United States, but the funny thing about Taiwan is that they base their system on our Medicare system using U.S. consultants, okay, during the 1990s. Okay, so I don't have the figure here of exactly what they spent per capita, but I'm pretty sure I'll try to research it, okay, and find it again. But I'm pretty sure that they're in something like the $3,000 per person range using a system based on our Medicare system. Our consultants, Medicare consultants, went over there and structured their system for them during the 1990s. By 1993, they've living under that system ever since. They spend a fraction per person, okay, of what we spend. Uh, they're covering about 100% of the population. It's a very high quality standard. Okay, I know Chinese who live here and who work here, okay, who when they have to have serious surgery, they go back to Taiwan, okay, to get it because it's so cheap there and they can afford to take the trip there and still spend far less than they would spend for medical care here. Anyway, what I wanted to demonstrate with these figures is the possibility that if we pass our Medicare for All system, we might be able to get our healthcare spending down to 50% of what it is now. Okay, I can get rid of that now. So here's the argument. It's a counterfactual, really. If we had had our Medicare for All system passed by 2022, we might well have spent, as a nation, instead of spending $4.3 trillion, we might have spent 50% of that, which is $2.15 trillion. Our governments, federal and state, are now spending $3 trillion, as we showed you before, or they were actually spending that using the 2020 percentage for government financing. That percentage probably would have been higher if we used the 2022 percentage, but I didn't have access to that figure because the study only went to 2020. So let's just use the 2020 figure. It only makes the argument stronger. That's $3 trillion in spending. We're estimating that governments covered $3 trillion of the $4.3 trillion in 2000, okay, and 22. If we had had a Medicare for All system in 2022, then the federal government could have covered the whole thing, every last dollar, and spent only $2.15 trillion. Now, I know people can come in and argue and nitpick about this and nitpick about that and talk about what studies that have estimated what we're likely to spend from the bottom up show, and say that I'm wrong because it wouldn't work out, that we were only spending 50% of what we're spending now because of this special characteristic of the United States, or that special characteristic of the United States, or the other special characteristic of the United States. But what I'm telling you is the only three Anglo countries with cultures similar to our own in 2023 was spending roughly 50% of what we were spending per person. Is there really any reason to believe that we would be markedly different? Let's say we were somewhat different and we would have spent $2.5 trillion instead of $2.15 trillion. In other words, I'll give away $350 billion. It would still be the case that our government, our federal government, could have covered the $2.5 trillion all by itself and spent no more than it is spending now. And everybody would have been covered. The outcomes would have been far better because the outcomes in all these other countries are far better than they are here in the United States on almost every measure. That's what a Medicare for All system could have done for us. And to go back to the Peter G. Peterson Foundation little piece that they had, of course, if you bend the cost curve from $4.3 trillion down to $2.5 trillion or $2.15 trillion, that's going to have a great effect on the projections for the future. Now, I'm not saying that has any effect on fiscal sustainability. It doesn't, because fiscal sustainability has nothing to do with the level of the debt or the level of the debt to GDP ratio. That's just a mistake by the Peterson Foundation. But what I'm saying here is that CBO's projections are way, way off if we pass a Medicare for All bill. Way, way off. They would be entirely different. That's what I want
Mhm.
to keep in mind. That BS projections by organizations like the Peter G. Peterson Foundation and like the Congressional Budget Office have no meaning. They are subject to our actions. They are subject to our policies. They are subject to policy decisions. We can make the Congress pass. Now you're going to say, of course, well, really, you're being very unrealistic, Joe, because we can't make the Congress pass anything right now because the Congress is bought. It's bought by the healthcare interests. That's why we can't pass Medicare for All in the first place. That's why we're spending twice as much as similar countries to ourselves. That's why we're getting worse outcomes. That's why we're having shorter lives. And you'd be right about that. But at Dump the Corruption, at Empowering Democracy, we have the cure for that. if you will only join with us in implementing the cure, because the cure is a bottom-up cure. And the cure comes from all of the voters, ourselves. We need to implement that cure in 2024. And that cure is given by the dump the corruption idea and by the rule, which you have seen so many times here before. That rule is vote against every candidate except those who won't take money from, okay, notice again, vote against every candidate. This is not about who you vote for, it's about who you vote against. Every candidate except those who will not take money from wealthy corporations, individuals, that is, wealthy individuals, uh, PACs, or party committees, and who repudiate all super PAC support. And what we are saying here is if we all come together and we all do this, all the board people in Congress who are preventing us from passing a Medicare for All bill will be gone. They'll be gone from the Congress.
We can celebrate.
Hakeem Jeffries will be gone. Nancy Pelosi will be gone. Catherine Clark will be gone. All of the people in the House, Steve Scalise, will be gone. Kevin McCarthy will be gone. All the people who are opposing Medicare for All will be defeated. Do you know why I know this? Because we've done all these studies on the Dump the Corruption program, examining the money people are taking. And we did not find, we've gone through over 200 politicians now, and we did not find one politician who would survive this rule. Not Katie Porter, not Alexandria Ocasio-Cortez, not a single politician, not Bernie Sanders, not Mitch McConnell, not Chuck Schumer, not any of them would survive this rule if everybody followed it. We would have a whole new Congress, a whole new House. We would have a new 1/3 of the Senate. Now, the Senate stands every 2 years. So in 2024, we can only get rid of 1/3 of them. But that means we'd be getting rid of 1/3 of the board people. That means we would probably have enough people on our side to get rid of the filibuster in the Senate, because all the new people would want to get rid of the filibuster because they're unbought. And the filibuster stops them from passing the legislation they want to pass. So if you get 1/3 of the Senate against the filibuster, and you have the people in it now who are against the filibuster, there are considerable people in it now against the filibuster, you'd have the 51 votes you need to get rid of the filibuster, to use the nuclear option to get rid of the filibuster. You won't even have to use the nuclear option, because when the Senate was being organized in 2024, they just wouldn't pass the filibuster rule. So the Senate would be governed by majority vote. And once that happens, people in the Senate who were for Medicare for all would be able to pass the Medicare for all bill. How do I know? Because 70% of the voting population is for it. So they would pass it. And the totally new House would also pass it. And we would have Medicare for all by early 2025. And we would knock those projections of the Peter G. Peterson Foundation and the CBO into the proverbial cocked hat. So, D,
As we've said this over and over and over again, dumping the corruption is the only answer. It's the only way things will change. Foreign policy wise, internally, in the USA, the only way things will change is by changing the people that are there, that are taking lobbyist money. And as we see, everybody's doing it. They're not representing us. They are representing their donors. We have to get rid of them. We will not see change until we get rid of them.
that's true. That's absolutely true. None of the changes we would like to see, such as the Green New Deal, such as Medicare for all, such as also student debt elimination,
Mhm.
such as the renewal of the child tax credits, such as all the infrastructure bills we need to pass, such as the federal job guarantee, such as congressional resolutions stopping the war in Ukraine.
And starting new ones. None of that's going to change until we
None of
get rid of
that's
these
going to change
warmongers.
until we get rid of the warmongers and the money from the military industrial complex that is sustaining them with huge quantities of contributions each year. The rule gets rid of the toxic money. It makes the money itself toxic to the candidates who take it. That's why we would only get candidates who don't take it. That's why we would only get candidates elected to office who would look to the people for support. How do they get the support of the people? They pass good bills that the people like.
They work for the people.
They work for the people, yes. They would have to work for the people because the donors couldn't pay them anymore.
Mm-hmm.
I mean, yeah, they could send them money, but the very fact of their sending them money would disqualify those candidates because the rule would get rid of them.
Yes.
So the donors would have to find another way. They're clever. They'll find ways which will be moderately effective. But without the pretty direct buying of the politicians, which this rule gets rid of, they would never be able to overcome a good idea again. By the way, with an entirely new Congress in 2024, guess what? we could expand the Supreme Court to
Okay.
15 people, 6 more people, so the new justices could outvote the Republican justices who've been doing all these terrible things 9-6. We could do that. We could also pass laws that prevented the Supreme Court from actually reviewing legislation, using Article 3 of Section 2 of the Constitution to do that. Guess what? We could even pass an amendment through Congress to outlaw big money in politics. We could get rid of CU by a constitutional amendment. Now, it would take 7 years for that to become effective. But remember, this rule applies at every level of government. It applies to the state legislatures. It applies to local government councils that are passing the local laws. And it applies to federal laws as well. So all those people who are elected to those positions will be people who aren't taking big money, who only want to pass bills the people will like, will favor. That means we'll be getting legislatures at the state level that when they get a new constitutional amendment that would outlaw big money in politics, they would ratify that very soon. Under present conditions, if you pass that kind of amendment, it would probably take you 7 years to get it ratified by all 50 states or by a majority of the 50 states. It takes 37 states. It would take you 6 years to get ratification from 37 states. But with new legislators in all the states, none bought by big money, you might be able to get it through in 2 or 3 years. That's a wonderful horse of a different color. So, anything more you want to add, Dee?
I think you pretty much said it all, but it's just so infuriating that people just don't get it. Or they just don't feel like they have the power.
This is a matter, okay, this is a matter, okay, of organizing. If you can organize people, okay, to get a Medicare for all bill, and lots of us are trying to do that right now.
Mm-hmm.
Okay, the red beret means that I'm a member of a group called Red Berets Medicare for All. We're trying to organize the voting population and get a sufficient amount of support to compel Congress to pass Medicare for all. Well, if we can do that, why wouldn't we be able to get enough people to follow this simple rule? I mean, everybody can see on its face that it's going to drive toxic money out of politics. You can see it just by reading it. If everybody joins together, if they prioritize getting money out of politics over everything else, the result will be that a majority will rule with respect to everything else, finally. So, we got to do our best to organize this and get people to listen and get people to follow it.
Yes, we do.
Okay? It's not real complicated. We got to get people interested. So please share, like, and subscribe. And please share the idea with your friends and family. And please get this going. We still have a number of months until the primaries start. And we have a lot more time than that until the election of 2024. We don't have to be satisfied with Trump versus Biden in 2024. Consider, let's say the Dems nominate Joe Biden, and let's say the Republicans nominate Donald Trump. And most people don't want either of them. If they use the rule, if people use the rule and vote against those people who are taking big money, guess what? No Trump and no Biden, because they're both taking huge amounts of money. Now, there may be someone you like who is also taking huge amounts of money. But what we're telling you is that if someone's taking huge amounts of money, no matter who it is, they will be working for the donors on the topics the donors care about. They won't be working for us.
We've seen it. We've seen how they're not working for us.
I'm sorry.
I said, and we've seen it over and over and over again how they are not working for us.
Yes. Yeah, yes, we have. Okay, there's a case. I'm not sure this is a valid case yet. It may not be. I may be misinterpreting it in some way, and maybe it's all due to a misunderstanding. But in recent days, as we explore the Robert F. Kennedy campaign, we see, that Robert F. Kennedy seems to be taking a throwback position concerning the relationship of Israel to the Palestinians. Why would he do that? He's saying he is doing it out of conviction. But guess what? He has to raise a lot of money for his campaign, he believes, because Trump and Joe Biden are going to have impossible amounts, of money. There are billionaires out there who are completely committed to what the right-wing government of Israel, is doing. And they're going to want to support people who are totally committed to this particular right-wing government. Maybe Robert Kennedy is trying to fix it so no one will be able to go to the right of him when it comes to Israel. Maybe he's looking at those billionaires and their huge amounts of dollars, and he's thinking, if I get those dollars, then I can beat both Biden in the primaries and Trump. In fact, if I can get those dollars, I might even be able to run as an independent. Maybe he's thinking that. Just saying. I have no idea whether that's true. But I haven't heard a politician talking like he's been talking about Israel for a long time. I mean, you can make friendly statements towards Israel, heavy commitment statements towards Israel. But if you hear Bobby Kennedy talking about Israel these days, it's simply ridiculous. It's as if he has a list of Netanyahu talking points that he's spouting in quick succession, nearly desperately. So I'm just wondering what the heck is going on. How you can say at this late date that Palestinian human rights are to be totally ignored, and that the only thing that's important here, okay, is the security of the right wing regime in Israel?
It's absurd.
Yes, what he's been saying is absurd. Anyway, perhaps I shouldn't have brought this issue in because
But
I
it's
don't,
an
I don't,
example. It's an
I don't.
example of taking donor money.
It may be an example. Okay, I don't really know if that's true yet. It's a possibility, but I don't really know. Okay, if it's true.
And if he wanted to be fair and balanced, he would really understand the Palestinian plight. Like he's speaking to that particular rabbi you were saying. Why not speak to somebody that understands the Palestinian situation?
All right, and even if he was speaking to Rabbi Shmuley, who, by the way, has been someone who's been extensively supported by the Sheldon Adelson fortune, one of the billionaires, okay, I've been talking about. Okay, and he might have spoken to Rabbi Shmuley, expressing all kinds of support for the state of Israel, but also pointing out that the Palestinians have human rights that have to come into the reckoning, that the Israeli Defense Forces just can't go around shooting people at will, even children, at will. For that matter, American citizens at will. Here I'm talking about a Palestinian American journalist who was an American citizen who was assassinated last year by an Israeli soldier. The soldier was exonerated. It was said, okay, to be an accident, but it was very hard for that, okay, to be an accident because the American Palestinian reporter was shot. She was shot in a very vulnerable place between the body armor that she was wearing okay, and other parts of her that were not so vulnerable. The shot was true. It had to be deliberate. Couldn't have been, okay, an accident. She was wearing all kinds of markings indicating she was press. And she was a famous journalist. Okay, besides, widely known, okay, in Israel, it was as if the IDF was deliberately hunting her. Okay, anyway, this has taken attention away from the rule. I want to go back to the rule. The most important point here is getting rid of the toxic money. And by doing that, changing the political system of the United States forever. To do that, we have to use the rule. We have to act all together and use the rule, come what may, whoever it hurts. Whatever attractive candidate falls because they fail to conform to the rule, that's too bad. The rule is more important than any single candidate. Getting toxic money out of politics is more important than the survival of any single candidate. And by the way, any candidate running in 2024, if they see the rule is taking hold, okay, among the politicians, if they can see the rule is taking hold, okay, among the population, they can change their behavior. They can stop cold taking the contributions they've been taking. And they can say, they can announce from this point forward, I will only take small individual contributions of less than $200. And when they announce it, Open Secrets will tell us whether they've kept their promise. And if they're keeping their promise, then we can go ahead and vote for them if we like them.
Mm-hmm.
So politicians running for office in 2024 can avoid their defeat by
Mm-hmm.
just saying they're only going to take small individual donations of $200 or less. No PAC money, no party committee money, no super PAC money, no money from the wealthy corps, just money from individuals of $200 or less. That's it. By the way, you can raise a lot of money that way. If I recall correctly, in her last campaign, Katie Porter raised $15 million from small individual donations. That's plenty of money to win a congressional race. So there you are. Is it time to say goodnight?
I think so.
Okay. Okay, thank
Yes.
you for coming, Dee. Okay,
Thank you for
I
having me.
hope that you and Madeline had a very interesting conversation after I left.
Yes, we did. We went over things and got her opinions.
Good. Okay, well, I'll see you tomorrow.
Yes. See you tomorrow at 8 p.m. and 9 p.m.
Okay, if the creeks don't rise, I'll see you tomorrow.
Yes.
And I pretty much can say what I'm going to do tomorrow.
Okay.
Okay, I might as well say that. Uh, what did I do? I just screwed up and took down what I'm going to do tomorrow. So let me get that back up again. Yeah, here it goes. Okay, so some people, there's been something going on lately with the credit agencies well-known credit agencies like, for example, Moody's, uh, also Fitch, Standard and Poor's. These agencies have decided from time to time that they have the standing to downgrade the credit, okay, of monetary sovereigns. So just in the last couple of days, in fact, on August 1st, evidently, maybe it was before August 1st, but the article covering it was from August 1st, talked about the credit rating of the United States being downgraded by Fitch, that credit agency, from AAA to AA plus. That downgrading, okay, of the United States credit rating was based on the idea that the U.S. could possibly default, okay, on its debt. Obviously, it had something to do with the debt ceiling crisis recently, and also the coming budgetary crisis we're expecting at the end of the fiscal year. And so Fitch decided that a monetary sovereign with a constitutional amendment requiring it to pay all its debts can go into default and therefore is a credit risk.
Crazy.
I'll be discussing that. And in the process, I'll also be discussing the time when Standard and Poor's decided they would downgrade the credit rating of the United States. And also the time when Moody's decided that it was going to do that. And I'm going to tell you what happened in each of these previous two cases. And then we can evaluate whether Fitch should really be tugging on Superman's cape. Anyway, that's what tomorrow's show is going to be about.
That sounds like it's going to be interesting.
Yeah. Yeah. Okay. I think it's going to be pretty interesting.
Okay.
Okay, I think it's time to say goodnight. There is an advertisement here from someone who came, okay, and made a comment. Okay, I'm not going to read the advertisement. I don't really mind that he did the advertisement, but
It's fun.
it's not part of the stream. So good
Okay.
night again, D.
Yes, good night again. And please remember to hit the like button.
Oh, and buy us
subscribe, and
coffees.
share. Yes.
Yeah,
Buy us
buy us
coffee.
coffees.
You might buy me a coffee, D Piers.
The D is your coffee thing up on your name?
No, it's not. For some reason it came off. I have to put it back up again. But
Okay.
it's the same name, D Piers, and at the end of Buy Me a Coffee. And we'll see everybody tomorrow.
Yes, indeed.
And
So
good
everybody
night,
have a
John.
good night, and thank you for coming.